What is the largest organ in the human body?
It's the skin.
Absolutely. And that is an organ that can't be replaced. If you knock off a kidney, you can get another kidney, potentially. You can get a donor. Not that easy, but your skin is something you cannot replace. And it's something I harp on my teenagers for constantly. And I think it's important to understand, not only the type of product you use in sun protection, but the application and the frequency of application. Thank you once again for joining in for our Beauty and the Beast podcast. I'm, of course, Dr. Sal Pacella from San Diego, California. I'm here with my good friend, Dr. Sam Jejurikar, fantastic plastic surgeon, talented from Dallas, Texas. So, Sam, today we're going to talk about our favorite topic, skin, okay? Favorite topic as a plastic surgeon, skin is what we operate on, but we're going to talk specifically about skin care. What do you need to do to keep that skin healthy? So, Sam, this is a billion-plus industry.
$200 billion annual revenue industry.
Amazing, right?
Yeah.
Every single cosmetics company has, and other companies have options for skincare. There's so much out there. How do we make sense of everything?
Yeah, it's tough because, we are conflicted when we talk about skincare because most of us sell skincare products in our office. And there's a whole area of sort of medical grade skincare that's been marketed where people spend hundreds and thousands of dollars a month on their skincare products. But it turns out that's not really even a thing. Like medical grade skincare is not something that's recognized by the FDA. It's a marketing term that really describes who is selling the product and how it's packaged. Not to say that that's not good. Some of it is good, some of it isn't. But I think what our goal today should be to talk about the basics of skincare. What are the absolute minimum things you need to do? And then beyond that, what might be promising and what might not be. So if I were to tell my patient that there is one thing that is the most important thing for their overall skincare regimen, I know what I would say, and I'm pretty sure you're going to tell me the same thing. What is it?
Hydration.
Okay, I wasn't going to say that, but that's a really good thing to say. But that's not, but of a product you would put on your skin.
Okay.
What's the number one thing they should be putting on their skin?
Moisturizer.
Sunscreen. Are you just trying to mess with me?
Well, yeah, of course.
Yeah.
And so let's back up a second. Okay.
Yeah.
So I think, in my opinion, the care of your skin is not related to what you put on the skin. It's related to what you put in your body. Okay. That really is my philosophy. And I think, nutrition is a very important point for skincare. I think hydration is a completely disassociated thing when we come to talking about skincare. And I can tell even personally in my life, okay, I'm spending a day in the operating room and I'm not drinking water or drinking electrolytes. And I look at my face afterwards and it's just, bleh, right? And so I think hydration is really key. But I absolutely hear what you're saying. Yeah. Sun protection,
and I clearly
most
can't
important.
argue against hydration.
Right.
That's clearly, yeah, that really.
But skincare related to sun protection is absolutely critical. So along those lines, tell me a little bit about, SPF and what's in the sunblock or what's in the sunscreen. So what do you tell patients? What is an important product to have? What's an important product to avoid?
Yeah, so I think when we're talking about sunscreens, there's a wide variety of products that are out there. The most important thing that I'll impress upon people is, it used to be you'd have to say, is it blocking UVA, UVB, zinc oxide? Does it have it? Every sunscreen that I see that's out there right now basically is the same at any store that I spent 10 minutes looking at CVS, looking at all the sunscreens. And the SPFs of facial sunscreens all tend to be 30 or more, which is sort of the minimum threshold that we're looking for. And to me, it doesn't matter if your sunscreen costs $15 versus whether it costs $200. To me, what matters is that you're applying it every single day. So what I like to tell patients is make sure you're applying sunscreen daily. A $15 sunscreen applied daily is a lot more effective than a $200 sunscreen that's applied every now and then.
Well, let's go back to something you just said a few minutes ago. So you said you went into CVS, you looked at them, and they're all about the same. Okay. Is that true though? The ingredients for sunscreen?
I think I'm not sure exactly what you're getting
Okay,
at.
so specifically,
tell me your
so
point. Yeah.
okay, so let's kind of go back to that CVS, okay? And I'm, when I was a younger person and I didn't have a ton of money, and I just buy the lowest thing on the shelf that's the cheapest, right? Spray on sunblock. That sunblock or sunscreen has avobenzone in it, right? Okay. Now when I put on sunblock, I surf quite a bit, I'm exposed quite a bit. I use a stick-on that has a reflective sunblock in it. Okay, so that is zinc or titanium. So, what do you know about avobenzone or things that have the BNZ in them in sunscreen?
What do I know about them? You have a point to this that I don't know where you're
Okay,
going with this.
so
yeah, why don't you just tell me? Yeah.
Okay, so that is a product that is almost on the verge of being banned by the FDA. Okay, so that phrase or that prefix, if it's a suffix or a preface, okay, BENZ, that is a hydrocarbon that is known to be carcinogenic. Okay, and
But is that even? Are they selling those products anymore?
they still absolutely are selling those products. I can tell you, I'm always trying to put sunblock on my kids. We have products all the time that we see that come, my wife might buy them, my kids might buy them, and they absolutely have those. And to this day has not been retracted off of the market from the FDA. So one thing I tell my patients is they constantly ask me about sunscreen, and I say, here is what I use. I use this surfer block. It comes in a stick. It comes on white. Okay, it's not a fashion contest. Okay. It doesn't matter to me if it's white or not, okay? They do make some expensive sunscreens that are zinc and titanium or reflective sunblocks that are clear, okay? Those I think are okay, all right? I do my best to have patients avoid the ones with benzene in them because it can be toxic. We simply don't know the extent of it. It destroys the environment too, not to sound like an environmentalist, but that we have some stewarding to do. That gets into the water supply, it gets all over the place, and it is a carcinogen. And so, I am a firm believer in the reflective sunblocks.
Yeah. Yeah, I think that's very important for our viewers, to know. And then again, it illustrates, I think, that a lot of the products that you can buy that will be useful, there are ones that you can buy over the counter. In our med spa, in our practice, we obviously sell more expensive products that are, not white and that are titanium and zinc oxide. But ultimately, I think you can get by with a relatively inexpensive product.
Right.
The next thing that I think is really important as sort of a mainstay of skincare is some form of retinoids or retinols. And so, as you know, tretinoin used to be called Retin-A, but tretinoin is sort of the medical strongest form of retinoic acid that's out there, and it comes in different prescription strengths. 0.1% is the strongest. What's the point of retinoids? Retinoids actually will cause epidermal, or the top layer of the skin, to turn over. It causes fibroblasts, which produce collagen to grow, and then it causes more collagen synthesis. So if you look at the product that we apply to our skin that I think does the most in terms of reversing the signs of aging, it's retinoic acid. The problem is many patients, when they apply retinoic acid, think they're having an allergic reaction to it. They'll say, it's making my skin peel, it makes my skin turn red, and they will discontinue. And that's really a sign that it's actually working. So in the world of cosmeceuticals, they've now developed a lot of retinol products. Retinols tend to be a lot more expensive, but less potent than retinoic acid, but it can be better tolerated from a side effect standpoint. My personal philosophy, and please tell me if you agree with this, is I do think retinoids are very important for patients. I'll tell them, we want you to use this product for 6 months to a year to kind of create maximal improvement in your skin quality. And then once you sort of reach this point of stabilization, you can transition to a retinol product. And then at that point, it's going to be maintaining what you've done with that.
Mm-hmm.
Do you find, I'm sure many of your patients are on that. Do you have any sort of philosophy where those products are concerned?
Yeah, I think the traditional product of Retin-A, I think, is something I'm pretty familiar with. Particularly, I do a lot of skin cancer reconstruction, a lot of skin cancer work. Our dermatologists recommend that all the time because it reduces, as you said, it flakes off the epidermis. If you have skin cancer, you can kind of see it come through the skin a little bit more. So I agree. And I think it really is about patient tolerance. That episode you said, well, I'm allergic to this. I do hear that not infrequently from patients. So it's really about tolerance of what they can deal with.
Yeah.
So.
And I think the next pillar of a skincare regimen should be some form of antioxidant treatment. And that can be a vitamin C or vitamin E, niacinamide product. Basically, what you're doing with an antioxidant is you're getting rid of free radicals that can damage the skin. And again, I think that that, and along with bleaching creams and patients with pigmentation like myself, and even like you, who are a little bit, have some melanin to them, can be really helpful to make the skin look uniform and to give the skin a healthy glow. I think those personally are my pillars, that along with moisturizer. And I think, depending on people's budget, can probably be done for $100 or less a month in a way that can make their skin look very good. Now, the question is, what do you think about other products? Like products, your Exosomes all the time. Like we sell tons of Exosome in our med spa. Exosomes are products that have a lot of promise. They're supposed to be releasing signals, the DNA signals that are going to essentially allow your skin to have these beautiful properties, but there's just no data to back this up. So when people ask me what I think about Exosomes, I tell them not to spend their money on it. I don't know what you think about that.
Yeah, I agree. It's, I think in medicine, we have to understand that we make decisions on evidence, right? Mm-hmm. And so we don't make it on popularity or marketing necessarily, right? And so I agree with you. There's all sorts of stuff out there that's talking about how beneficial it is for skin, and a hell of a lot of it is not proven.
Yeah. Now, let's say you have a patient, Southern California patient, who's spent their years out in the sun, and they just haven't done a great job of taking care of their skin. And they come to you, they have a lot of pigment changes, they have fine wrinkles. How are you going to tell that patient, look, this is the thing that I think you should do first for your skin? Like, or is it going to be skincare? Is it going to be some type of resurfacing? Like, how are you going to steer that patient?
Yeah, I think, for those patients with tremendous sun damage from skin or from the just not paying attention for years, I think there's the best and most important strategy is laser treatment, laser resurfacing. But that is in a sequence as you describe. Okay, so I think before you do laser, you have to prep the skin in order to do that, right? So, and that's where the retinols and retin-A's come into importance, right? So you want to sort of flake off all that dead skin first. You want to recompact the stratum corneum and the epidermis. You want to get it ready for that laser treatment. And there's all sorts of lasers out there. In fact, there are Swiss Army knives of lasers that you can use. Fractionated lasers, full CO2 resurfacing lasers, PDL lasers for pigmentation things. And again, I think you have to choose the right weapon in your armamentarium for each particular patient.
Yeah, and for patients that are out there, it can get really confusing. I think there's basic terms that they should know. Ablative versus non-ablative lasers, basically how much heat is it generating versus it not generating heat. Fractionated versus non-fractionated. Non-fractionated or full field, there's no little skip areas, tends to be a slower recovery. Fractionated, you create little skip areas. CO2 versus erbium. Basically, it's telling you what the chromophore, what the laser is attracted to. CO2 and erbium patients tend to come in requesting CO2 lasers a lot to me. And that's fine. We have CO2 lasers in our practice, but a lot of times erbium is going to be better for them based on their skin pigmentation. And so I think patients should realize that the efficacy of a laser treatment is very much related to the downtime. The longer it takes for you to recover from it, the better the treatment's going to be for them.
Right.
So, I think it's not a top, in the beginning you said this is a topic we're very excited by. There was an element of sarcasm to that. Surgeons like talking about surgery, not about lotions to rub on your skin. But it can be confusing. There's lots of products that are out there. And the the mentality for patients sometimes when they haven't taken care of themselves is that they need to throw a lot of money at something to fix it. Remember, if you are a patient, if you are trying to figure out how to take care of your skin, make sure you do hydration, like Dr. Pacella said. Use a titanium oxide or zinc oxide containing sunscreen, like Dr. Pacella was saying. Use retinoids in the beginning, and then you can transition to retinols, use some sort of antioxidant, use moisturizer, and that's your skincare regimen right there.
Right. Let me make a point here too. And I think for those of the listeners and viewers out there that have children, okay, and I am a father of teenagers in Southern California. It's a constant struggle on sun protection. Okay, what is the largest organ in the human body?
It's the skin.
Absolutely, and that is an organ that can't be replaced. If you knock off a kidney, you can get another kidney, potentially. You can get a donor. Not that easy, but your skin is something you cannot replace, and it's something I harp on my teenagers for constantly. And I think it's important to understand, not only the type of product you use in sun protection, but the application and the frequency of application. For example, for somebody who does a lot of eyelid surgery, particularly cancer eyelid surgery, okay, I can't tell you how many times I have patients come in with cancers along the margin of the eyelid. And they say, I've used sunblock for 20 years. Okay. Well, we don't really tend to put a lot of sunblock on our eyelids. No. And that is an area that is problematic. Or, doc, I don't know what the issue is. I use a big brim hat all the time. And why did I get this skin cancer on my upper face below my eyelid? Well, sun does bounce off the pavement and it gets reflected back upwards. So it's really not enough to just simply wear a hat. You're not getting direct exposure, you're getting secondary exposure. Glasses, okay? Sunglasses, one of the things we wear to protect our eyes from the sun, sometimes cause problems because if you look at my glasses here, there's a convex surface on the inside. If I'm wearing my glasses like this and ambient sun is hitting from behind me, well, guess what that's doing? It's focusing right back at me on my eyelids. And so certain areas are really susceptible to sun damage, and that's in and around the eyes and around the nose, the ears we constantly forget about. So hammer your kids, get them really believing in sunblock. It's the only skin they have.
That's great advice. And on that note, I think we can wrap up this episode. Thanks for tuning in, and we'll see you on the next one.